Yeah.
Good afternoon, everyone. Thank you for joining our webinar today. My name is Rizwan Shahid, and I am representing Geographies of Health and GIS Analysis Working Group of O'Brien Institute of Public Health. Our group serves as a hub to connect geographical expertise with health research and practice, enhance spatial literacy, and expand the use of GIS for better decision-making in healthcare delivery throughout Alberta. You can find more details about our group and contact information on O'Brien Institute's website. It is my absolute pleasure to introduce Dr. Ashok Krishnamurthy. Ashok is an associate professor in the Department of Mathematics and Computing at Mount Royal University. He is also an adjunct faculty in the Math Stat department at the University of Calgary. I first met Ashok 2 years ago at the Health GIS Spatial Thinking in Applied Research, a GIS Day event that we had organized from Geographies of Health and GIS Analysis Working Group in November 2018. I was highly impressed with the quality of the work he presented at that event. He has been working on some cool projects on spatial tracking of diseases using open source tools such as Gridded Population of the World, NASA's Panoply, and R programming language. That makes me quite jealous because in spite of many attempts, I could not learn R programming. Maybe I need some tips from Ashok. Please join me in welcoming Ashok to this week's seminar. Ashok, why don't you tell us a little bit about yourself and your background?
Thank you, Rizwan. I want to first of all thank the O'Brien Institute of Public Health for extending this invitation. I also want to thank Rizwan for emailing me back in January and inviting me to come give an in-person presentation at the Foothills campus lecture hall, where I have attended many talks over the years. So I just have this strange disconcerting feel today that you are all able to see me, but I'm not able to see any of you. Yet here we are. I am an associate professor at Mount Royal University. I've been with Mount Royal University since 2011. We are a premier undergraduate institution here in Calgary, Alberta. I teach statistics and mathematics courses to the undergraduate folks. And I want to tell you that when Rizwan invited me to give a talk in January, I was supposed to co-present with another professor from Japan. Obviously, due to travel restrictions, they couldn't make it here. So in terms of introduction, I live here in Calgary. And so you can continue to hear my wonderful voice. I'm going to turn off my video now. I find this helps with my presentation proceeding seamlessly, and you don't have to stare at my bedhead for an extended period of time. I will turn my video back on during the Q&A period. So please just hold on for a second as I turn off my video. So with that said, I will dive right into my presentation. I've been working on this project for a few years now, mathematical modeling of infectious disease epidemics. And this project and its end results wouldn't be possible without the following people. I want to acknowledge my postdoctoral research supervisor, Professor Lauren Cobb. He's now retired, happily retired in Mile High City, but him and I speak almost on a daily basis. I ask him a lot of questions. He gives me a lot of advice. I also have brought in several undergraduate student research assistants. In fact, I hired 3 new students, the names listed there, Alyssa, Brittany, and Jocelyn, just this Monday, a few days back, whom I haven't had a face-to-face meeting yet. And there are so many other students who have been contributing over the years. Throughout this presentation, you will see a lot of maps and contributions from these students. I also want to acknowledge Matthew Whiteside and Chelhee Lee from the Alberta Health Services with their help with R programming language. Now they say the most eloquent presenters begin their presentation with a joke. I'm going to try my best. So let's see, here goes. I want to give a big shout out to my family. Here you see Akash, my oldest son, 7 years old. He aspires to become a Lego master builder. And this is the little one, Akshay. He is a year and a half old. All he can speak now is Goo Goo Gaga, and he is really the boss of the house. This is my wife, Nisha, aka Miss TikTok. I meant to say she recently discovered TikTok. You know where I'm going with this. The house has been transformed into a mini park. Kids are a handful, no class, no daycare, so no school. So they're keeping us busy and keeping us on our toes. Yet this is a regular weekday morning. My little one is happy with his baby shark. The other guy has been collecting 3 million gold coins. And there you have my wife. She's working full time, working off of her couch, but still classy. Now they have enough screen time. I was wondering, what about me? Let's talk screen time for me. I wake up in the morning, grab a cup of coffee, I turn on my screen. I enjoy watching Dr. Fauci and Cuomo debate over coronavirus. I see Mike Pompeo go network after network, sharing enormous evidence virus began in a Chinese lab. A few minutes later, I watched Dr. Theresa Tam, who is, by the way, is wonderful, the Chief Public Health Officer of Canada. I watch other videos, including Dr. Berg's, Dr. Hinshaw. I also read several articles, as you can see one here. They say that herd immunity is attained by mounting an enormous worldwide vaccination campaign. That's one way to go about. And there is another way where the herd immunity could work for poor countries by infecting everyone. Is this really possible? I don't think so. I don't think any country has the will to act on it. Although, as Thanos once said, if life is left unchecked, life will cease to exist. This was an infinity war, and the hardest choices require the strongest wills. And then I also listen to our Prime Minister. I also listen to the newest press secretary, McCanney, who made a statement. The idea that everyone needs to be tested is just nonsensical. This is the first hour and a half of my day. I go up, have my lunch, come back. Next thing you know, you have Trump trending with disinfectants, Lysol and Windex. This is all half a day of my work. But to top it all off, probably CNN is having a very slow day. There is a video of Dr. Gupta showing you how to run outside. Come on, give me a break. So what I do is I try to have some fun. I loop this video and speed it up and let Dr. Gupta run for a small marathon. I know I said I'm going to try to start with a joke. I don't know if it fell flat. I can already hear some crickets chirping. So without further delay, I'll get into my presentation. Today, my presentation has 3 core topics that I will like to cover. First, I will talk a little bit about the gridded population of the world. And then I get into some mathematical models, the non-spatial and spatial temporal models. If anybody is averse of math, I can tell you that there are only 3 or 4 slides at the most, which has math equations. There are plenty of maps. So if you're into maps, you might enjoy this presentation. I'm going to specifically address the problem of tracking COVID-19 in Spain. And then I'll move on to the work we have been doing in tracking Ebola for the past year and a half. And if time permits, I will get into our efforts in tracking measles in pre-vaccine era England and Wales. First, I would like to talk a little bit about the gridded population of the world. Now, you may see in the chat window, Angela has posted a link for this particular presentation as a PDF format. I also want to know that I also wanted to let you know that I use open source tools. So everything that you see in this presentation is available upon request. I can share with you the R program code, the map, and their documentation. So with that said, the gridded population of the world is used for the following purposes. Suppose you would like to know the population of Colombia. our intuition says, open up a browser, start typing what is the population of Colombia. And we would get a simple result like this, about 50 million people in Colombia. What if you would like to see it in a map? You know, a map like this for all of those 32 departments and one federal central district. If you search long enough, you will find a map like this. You know, the darker the shade, more people live there. The lighter the shade, you can see that the density is very low in several areas. With the gridded population of the world, though, it provides us with what is called as a spatially disaggregated population layer. They use census data from all of these countries, and they do a United Nations adjustment to the population count and population density, and they can be downloaded at various spatial resolutions for various target years for free. And I'm going to demonstrate in the next few slides on how one would go about downloading these slides, downloading these layers. These are raster layers. Okay. First, a little bit about the gridded population of the world itself. It has come through a long way from 1995 onwards, all the way to the version number 4, revision 11 that we are currently using. And you can imagine as years progress, the resolutions have become finer, the input administrative units have become more, and the quality of data has become rich. In its most recent release, we not only have the population data, but we also have the sex, age, urban, rural status, other socioeconomic data are also included, all in a raster layer format. Okay, here is a brief breakdown of what the GPW version 4 is offering to us. You have several target years of 2000, 2005, 2010, 2015, and 2020. And you have a resolution as fine as 30 arc second at the equator, which is roughly a kilometer by kilometer at the equator. In terms of an upgrade from version 3 to version 4, I did use version 3 a few years back. My supervisor had the C++ scripts, which would take in these bulky ASCII files and convert it into a format that we could work with. But in the recent years, they have switched to a format called GeoTIFF, Geo Tag Image File Format, which is a raster format, and it is a big compressed file. In its uncompressed form, it's several gigs of data, metadata. So you can see the comparison between version 3 and version 4. As years progress, the resolution has become more finer. Data has been very rich. Here is a comparison of Fiji estimates. You also have population density of Mexico. And you can download the population density for any country in the world for that matter. You could also get urban-rural designation. You can get the male-female sex ratio for any country in the world. And as I said, you could download the data in several resolutions. For my research, this particular COVID-19 research, I'm going to focus on the 15 arc minute resolution, which roughly translates to grid cells that are 30 kilometers by 30 kilometers at the equator. GeoTIFF or Geotag Image File Format is a computer file format for storing raster graphics. The entire world context as we download it for the 30 arc second resolution is about 400 MB file. And you can see it has 21,000 rows and approximately 43,000 columns. That's about 1 billion cells. So it's all compressed in that 400 MB file. The uncompressed version is about 3 gigs. So what we do is we take this raster file, and here is a flowchart of how you would download. You go to the website called cdac.csin.columbia.edu. So the CSIN is the host institution called as the Center for International Earth Science Information Network. And you follow these steps, you can download your GeoTIFF file. Here are some steps on how to download the GeoTIFF files. Go to this website, click the population, pick your target year, whether you want the population count or the population density. There is actually a critical difference between population count and population density. And then you have to create a free account, download your data. So this slide talks about the difference between population count and population density. Population density is exactly equal to the population count at the equator. The further you move away from the equator, move north or south, Population density is translated as the population count divided by the true area in square kilometers. So it's really up to you on what format you want to download. For epidemiological research, I go with the population count. Now, going back to our original question of downloading the map for Colombia. So Colombia is highlighted there. I take this entire raster, I crop out Colombia alone. So I go to this website, I type in a country name. I could search for a continent or a city or a particular province. It'll give me the bounding box, the westbound, northbound, southbound, and eastbound. I use those 4 coordinates in an R program, just a few lines of code. I mean, here it shows it's 37 lines of code. If you remove the comments, it's about 10 lines of code. You can convert the GeoTIFF file to a format called netcdf. This is the industry standard in meteorological departments, the netcdf format. This slide talks about the netcdf format. It's a machine-independent data format that supports the creation of access and sharing of array-oriented scientific data, developed in Boulder, Colorado. I also use this free tool called NASA Panoply. This is nothing but a visualization tool for netcdf files. So I'm going to review the key steps we have done so far. Download the GeoTIFF file, use a couple of R packages, raster package and SCDF4 package, crop the region of interest, and view it using NASA Panoply. So here is Colombia's map, UN adjusted population count. I chose the target year of 2015. This map has 3 million cells at the 30 arc-second resolution. If you want to aggregate the map by a factor of 10 along the north and 10 along the west, you could factor it or aggregate it by a factor of 100 to make it look like this. Now you have 30,000 cells, not 3 million cells. You could also go ahead and do this exercise for other countries. I've done this for England and Wales when I was doing my measles simulation. On the bottom of the map, you see what is called as a color palette. There are dozens of color palettes that come along with NASA's default installation. I particularly like this Simmons Haxby color palette. So the darker the shade, the more number of people live in that area. Here is West Africa. A few years back, we were running some simulations for the model to track Ebola in West Africa. Here is Nigeria, 2020 population count at the 15 arc-minute resolution. I may have skipped a slide there. GPW map for China. You could also view the data in raw scale or in the log scale. You could see Brazil, raw scale and log scale. And like I said, I had hired a few student research assistants, Brittany, Alyssa, and Jocelyn, and they've been doing a fantastic job. Just a couple of days back, I gave them a task to see if they can import GeoTIFF files into this open source tool called QGIS, and they came back with these 3 images. I've assigned each one of them to a project of tracking COVID in Brazil, Spain, and Nigeria. So I also want to give a shout out to Mark, a senior GIS analyst from Suncor, who had a contact with a couple of days ago, and he helped us with adding the country boundaries and other fine-tuning measures to these maps. I would like to jump into the compartmental models of epidemiology. This is where I'm going to introduce a few math equations, right? In its most naive form, the SEIR epidemic model has 3 compartments: people who are susceptible, people who are infectious, who could transmit the disease to others when they come in contact with other susceptible individuals, and people who are removed. The removed compartment could contain people who have recovered and attained permanent immunity or have died due to the disease. Now, these compartments are mutually exclusive, and we make a few assumptions that the population size is constant throughout the duration of the epidemic. We also make an assumption that there are no vital dynamics. In other words, there are no, I already see a question popping up there. Thanks for the question, Aaron. Maybe I will wait till I go through my presentations fully and then address the questions. Okay. So this was proposed by Kermack and McKendrick back in the late 1920s. Each individual comes into one of these three mutually exclusive compartments. You could have other extensions to these compartmental models. You have the SIS model, SIRS model, which allows for recovered individuals to come back into the susceptible compartment, like the seasonal flu and all. And then you have SIRI compartmental model. But then when you introduce these latent periods, these incubation periods, you have additional compartments called exposed. People who have been exposed to the disease, but they are not infectious themselves. They wait in that compartment for a certain time period before they move into the infectious compartment. So for the COVID-19 research, we are going to use the SEIR, the second one that you see in the screen, SEIR, or spatial variants of this. In mathematical terms, the true mass action version is comprised of three ordinary differential equations. This is the non-spatial version. And then you have, going back to this, you have the parameters beta and gamma. Beta is called as the transmission rate. Gamma is called as the removal rate. And an equilibrium is always maintained. The sum of susceptible plus infectious plus removed is a constant throughout the duration of the epidemic. Okay. And I have some mathematical relations with respect to the ODEs. I want to talk about the basic reproduction number, or R0 as it's popularly known. R0 is the expected number of secondary infections produced when an infectious individual is introduced into a completely susceptible population, what is called as a virgin population. So the average number of secondary cases. It's calculated as the ratio between the transmission rate and the removal rate. Here is a screen with the R0 for various diseases. Measles is perhaps the most easily transmittable disease. It's not necessarily virulent, as in the case fatality rate is not as high as you would imagine for, say, Ebola or other diseases, but measles spreads much more faster than any other disease. COVID is about 1.4 to 5.7 persons on average per infectious individual. Some assumptions that we made include that infection and removal rates are constant, and we assume homogeneous uniform mixing between the individuals living in the population. And we also make an assumption that no individual may be infected more than once. When they attain immunity, when they recover, that's permanent, or when they die, well, that's permanent as well. Disease latency period is short. If you're going with the SIR model, the exposure period is short. And I have addressed this already: no vital dynamics, no new births, or no non-disease related deaths. There are other extensions to the compartmental models. I'm going to go with the SIR model for my Ebola and COVID-19 research. So that is with respect to the non-spatial ordinary differential equations. But when you're doing these kinds of mathematical models over a spatial domain, you have to view it as partial differential equations. So I want to acknowledge my collaborators in this project, Leonardo, Javier, and Adria from Barcelona Institute of Global Health, with contributions from Lauren Cobb and Elisa Pries for this project on tracking the spread of COVID-19 in Spain. A little bit of background and motivations for this research. The spatial-temporal dynamics of COVID-19 have received a lot of attention, in part due to the importance of the disease and its highly nonlinear outbreak dynamics. We wish to study the full spatial dynamics of COVID-19 as it spreads through the entire spatial domain. We seek primarily to clarify mathematical ideas rather than to offer definitive medical answers. So here you have a map of Spain Spain is comprised of 17 autonomous communities and 2 cities in North Africa, Ceuta and Melilla. 2 small cities on the bottom of the screen, Ceuta and Melilla, that is connected to Morocco and Algeria. Now, in terms of the GPW data, I downloaded the 15 arc-minute resolution data and cropped out Spain alone. You will notice that in Panoply, there is an option called interpolation, which you could toggle on and off. By default, it's turned on, but if you turn it off, you will see this pixelated image. That's exactly how the data is. At some point, I'll open up an HCDF file for you to show that the pixelated data is how GPW presents numbers to you. You will also notice that Portugal, France, Morocco, and Algeria are all blank because I purposefully set those countries to be uninhabitable based on their ISO numeric numbers. My primary focus is on Spain, and I'm going to let my simulation run only in Spain. So it's assuming that no people are coming in or going out of Spain. Okay. It's as if there is an imaginary wall built. No immigration or emigration. The resulting grid has 33 rows and 57 columns for the spatial domain, which roughly translates to 1800 cells. And what you see on the screen is the spatial distribution of the susceptibles. We use this as one of the compartments and add more compartments. So at this point, I also want to introduce you to something called Lucid Chart. It's a free service where you could create an account, and this flowchart that you see here, I created it in just 30 seconds. Create one box, copy paste it 4 times, and then add connectors and you're done. So Lucid Chart is something you might want to look into if you want to do your flowcharts. So right now I have my susceptible compartment. I add 4 more compartments: the exposed, infectious, recovered, and dead. So my model is called as a SEIRD, Compartmental Model of Epidemiology. Dr. Fauci often says, your models are only as good as your assumptions. So we have these parameters that drive us from one compartment to another. So the transition pathways from one compartment to another are derived by these parameters beta, gamma, sigma, and delta. I used the numbers from the literature. There have been hundreds of papers out there already. And I picked the numbers from peer-reviewed journals, the values for beta, gamma, sigma, and delta, to create the schematic diagram of the SEIRD model. We did think about SVEIRD model, which we use for Ebola and Congo. But for the COVID-19, there is no vaccine yet, though there are several candidates. Hopefully we will have a vaccine very soon. So we are not going to go with that. All said and done, we may end up using a little bit more complex model, which we call it as SEIIHRD model. There are people who are asymptomatic, who transmit the disease. There is rich data available on hospitalization. There is data available. Well, the most accurate data is the death data. If you look at all of these compartments, of all these epidemic states, death is the most accurate data available. So with the schematic in place for these 1881 cells, we have movement of people within each compartment. And the population flows along the arrows in this diagram. So I want to talk about the spatiotemporal model in terms of these integro-differential equations. So here we have these integro-differential equations where I would like you to put an emphasis on all terms getting cancelled. So therefore, there is an equilibrium maintained. Okay, let me go back to the slide if anybody wants to take a look at this. You have your parameters, beta, gamma, sigma, and delta, and your rate of movement from one compartment to another, and your integro-differential equations. You also have this weight function. Now, according to the first law of geography by Tobler, everything is related to everything else, but near things are more related than distant things. With the social distancing in place and all, this is all the more very critical that the weight function accommodates the measures of influence of infectives at spatial position UV on the exposure of susceptible set positions XY. So our weight function in this simulation is having this exponential function. I see a few chat messages. Okay, I'll address this again at the end of the presentation. Well, if you go back to previous two slides, I want to talk about the nonlinearity in the topological sense, only in the differential topology. This is only mildly nonlinear. The nonlinear term is really the first equation, S times I. I mean, this is a simple model in principle, though it is very computationally intensive. And I'm going to provide additional details later on. We also assume that the equations are numerically stable and convergent. So those are some assumptions that we go in with. About the weight function W expresses the idea that the influence of nearby infectives drops off as an exponential function of the Euclidean distance. Okay, so here you have the central cell, the newly exposed individuals in that cell, the central cell, tomorrow or a week later will be influenced by the weighted sum of infected individuals in the neighboring cells. So what you see here is called as a Moore neighborhood. There are other neighborhoods possible. Okay, so this is of radius 1. So what we do is we have these adjacency matrix, the number of exposed people today and the number of exposed people after one time step. The time step is really arbitrary. It could be 1 day, a bi-week, or whatever time step that you use in your simulations. The newly exposed people after one time step, this is where we introduce stochasticity also. It's a random Poisson with a mean given by the product of proportion of susceptible in that cell multiplied by the nearby infected multiplied by the intensity. And the nearby infected is defined as the weighted sum of the number of infected individuals in the current cell plus the neighboring cells. Okay, so nearby infected would include the current cell and the neighbors, the Moore neighborhood. Okay, moving on. I have this question. Have you opted into location history for your Google account? I know I have, and I get this monthly report as an email on the places where I visit. So this is a monthly report that you could download for any country if you go to google.com/COVID-19/mobility. As you can see, as of April 5th, 2020, Spain has had a significant drop in retail, visits to parks, transit visits, and workplace visits. Right? You can download this periodically, and you can use this to control your parameters, how your social distancing will be incorporated into the model. The integral differential equations that I showed earlier can be translated to ordinary differential equations at an individual grid cell level. So we define an operator acting on all compartments to account for all the transitions in and out of the compartment in the time interval dt. So here time interval for us is a single day. So I'm going to run my simulation starting say April 1st through October 30th. Spatial maps printed every day. For any non-math folks in the audience, this is what is called as a simple pseudocode. You have the current susceptible today. Some of the current susceptible are going to be exposed, so they leave that compartment. So the next susceptible will be this difference equation. And same rule applies to the other compartments. So when you add all of it, it becomes a 0 and an equilibrium is maintained. On top, I have something called as an inhabitable cell. The word inhabitable says to live in, or a cell where people can live in. So in the spatial domain, not all cells, not all of that 1800 cells are inhabitable. There are some cells that are uninhabitable. Like I made Portugal and France uninhabitable. You have the ocean, the Strait of Gibraltar, and all of those water bodies that are uninhabitable. So there won't be any movement of people or disease in those cells. However, for every inhabitable cell, this is what is happening as an update state matrix. And this process is repeated for a desired number of time steps. So we take this susceptible population as a map and we add more layers. Basically, you will see that on the top, we have the susceptible state and more states are stacked underneath it. To give it a better picture, we have the initial conditions for our differential equations. On day 0, the exposed, infectious, recovered, and dead are all a clean slate. So this model relies on me inserting new cases. How do I insert new cases? Well, I go to the official data and I get the prevalence for a particular day. Out of the 17 autonomous communities in Spain and the 2 cities, I dropped the Canary Islands and the Ceuta and Melilla. I'm focusing only on the 16 autonomous communities. And I introduce these initial infections. I also make the assumption that each of these initial infected individuals have already exposed twice as many people to the disease. Okay. And then I get the official records on initial people who have died. One has to realize of these compartments, there are 2 compartments that are called absorbing states, the recovered and the dead. Once people enter into those compartments, they remain there forever. Okay, those are called as absorbing compartments, absorbing states. And S, E, and I are called transient states. They could have people moving in and out of those compartments. S in particular only have people exiting, whereas the exposed compartment has people coming in and coming out, going out. Same with the infectious compartment, people coming in and going out. So I introduce these initial infections, initial exposed and initial dead, and I run my simulation. This is actually the prevalence map as of yesterday. And I asked my student, Alisa Priest, to create this map barely an hour ago. And she brought this back to me, which is fantastic using ArcGIS. There are about 66,000 active cases right now in Spain. And if you go to the official website, you also have the accumulated incidence data for the last 14 years reported per 100,000 inhabitants. So I think we are ready to view the animation or the simulation. In the following demonstration, the model parameters were set in advance based on the characteristics of COVID-19. And the model implements the worst case scenario in which there are absolutely no governmental or public health interventions. The public remains ignorant of how to avoid transmission of COVID-19 with limited social distancing. So this is my first attempt here. And I could create similar spatiotemporal maps for all other states, but I'm going to focus only on the infectious state. So I'm going to play an MP4 video that shows the progress of COVID-19 infection in Spain from April through October. And I'm also going to show with interpolation on and off. Be aware that the interpolation off will be pixelated. Okay, so here is the video. I'm going to hit play. Pay attention to Madrid and Barcelona, Valencia, and Sevilla. Those regions are the ones that are heavily battered. And you can see the time step. I'm printing, I think, 6 frames per second. So the simulation is running for 180 days or 6 months. And my simulation also gives an Excel spreadsheet in the end where you could look at all of those SEI phase planes and other time series graphs, incident maps and numbers like that. Okay, as I move on, this video is actually, this is the one with the interpolation turned on. And be mindful that each cell is about 30 kilometers by 30 kilometers, each grid cell. You have a few cases in Mallorca. We have a lot of cases in Barcelona, Madrid, and Valencia. All right, so that was that. We are also working on similar projects to track COVID-19 in Nigeria. So we have a few collaborators from the University of Maryland, University of Port Harcourt. So I'm not going to show the results for that yet because this is still a work in progress, COVID-19 in Nigeria. But I also have a project for tracking COVID-19 in Brazil with a couple of researchers from the University of Brasilia, Daniel and Saulo. And I'm going to switch my attention quickly to Ebola in Congo. Now, this is a project I've been working on for the past year and a half, and this has now been wrapped up. We have a fully finished manuscript if anybody is interested. Now, the Democratic Republic of Congo has its fair share of Ebola outbreaks over the year. In fact, the very first Ebola outbreak was back in 1976 in Congo. There has been some sporadic outbreaks here and there, but then the big one was in 2014 in West Africa. And you have those most up-to-date numbers. You have 3,562 confirmed cases, of which 2,268 have died. So the CFR, or the case fatality rate for Ebola, is way too high. In terms of vaccination, Ebola vaccines have been administered close to 300,000 people. And they were administered at a ring vaccination schedule. Okay. There are some treatments available for Ebola. I'm going to quickly flip through slides because I only have a few minutes left. So Ebola in Congo appeared in August 2008 in the North Kivu province. It quickly jumped to the Ituri province. And then a few months later, it went to the South Kivu province. So all the neighboring countries were put on high alert: Uganda, Rwanda, and Burundi. Uganda did have a minor outbreak, but they controlled it real quick. This is another ArcGIS map created by my student Murdoch. And with the same transmission dynamics and compartmental model of epidemiology, but this time including a vaccinated compartment, I have the following simulation. So let me quickly go through the simulation for you. We introduced the disease in 4 locations, and we ran this for a few time steps. This is in terms of our comparison of the total simulated deaths versus the total observed deaths. Okay. And the dynamic models for the SVE-IRD. The core of my research is actually to work with Bayesian data assimilation, because we have plenty of data available and we want to incorporate the data as we progress with the epidemic model. So I'm going to show you how we handled the 20-year measles data. Now this is from 1944 to 1966, which has a biennial seasonal peak. So therefore you see a disease fade out every other year. Okay. And a fully finished manuscript of this is available if anybody is interested. But I'll end my presentation by talking about data assimilation. Data assimilation is a general class of techniques for tracking a state vector in time using Bayesian updates applied to a dynamic model. Basically, what happens is you have a model. It doesn't have to be a compartmental model. It could be even an agent-based model. You use that model to project it into future for a certain number of time steps until a new data arrives. Once the data arrives, you put those two together to do what is called as a Bayesian update and feed it back to the model. Run the model again for a certain number of time steps until the next datum arrives, do the Bayesian update. So that's simply the idea. And we use specifically a data assimilation technique called optimal interpolation, but there are Kalman filter, particle filter, 3DUR, and other data assimilation techniques out there. And data assimilation can be simply done with the help of these two equations. Okay, but there is more to it than just these two equations. So I'm happy to share any information. These are the reported health zones, and we use the data collected from these health zones to do our Bayesian data assimilation. I'm going to show a before and after picture of data assimilation. And with that, I will end my presentation with this slide. Does social distancing work? I'm going to quote something from the book. Now, if you look at this map, this is from the 14th century Black Death or the bubonic plague, right? The regions highlighted in green are the regions where there were relatively low outbreak or low fatalities. So this in bordering France and Spain, that's a big national forest. But what's so interesting is Italy, and particularly in Milan. I'd like you to read this paragraph where it says, okay, I'm going to come out of. Right. When news of the Black Death reached Milan, the Viscontis, they were absolute despots, by the way, and their advisors acted quickly. Municipal authorities walled up those houses in which plague victims were discovered, isolating in them the healthy as well as the sick. So popular did this become that many householders followed suit, in some cases killing members of their own family. Given the plague's most common means of transmission, such measures should have had limited effect on mortality, yet Milan's death rate was less than 15%. That is in comparison to anywhere from 30 to 60% of Europe being wiped out back then. Probably the lowest in Italy, save a few alpine villages, but Milan was exceptional. But move to 2020, here we have politicians going on Facebook Live and saying, you are irresponsible idiots, colossal idiots. And there are certain more other mayors of Italy using some unpleasant words, asking people to stay indoors. So with that, I'll end my presentation. I really want to thank you for showing up. And if you have any questions, if you want any of these R code or any of these spatial maps, just please shoot me an email and I'm happy to address your questions. With this, I'm going to transfer control over to Rizwan, and I'll do my best to answer any questions that come in. I see a few questions that came in from Aaron. Aaron, we have been in touch via email, and I'm happy to copy all of these questions and address them to you. And if there are any other questions, I'm happy to answer. Otherwise, I'm going to stop sharing my screen and hand over control to Rizwan. Thank you all so much.